Thank you, Liz, and thanks for coming today. It's a real pleasure to be here with you. Lots of nice, familiar faces in the room, and some new ones as well. So, my role is to say a little bit about conversations with clinicians, and maybe it's important to say as we begin that is that what I'm going to be talking about does sound a little bit like actually we need to do it differently. Now, I know that everyone here already does it differently or knows about the value of doing it differently. And from my experience of working with clinicians and social care professionals across the country in the last 6 or 8 years, there are so many people already doing it in a way which is very synonymous with this coaching style. So while I'll be talking very generally, I think it's very important to recognise that change is already happening and people are always already doing a good job. And in fact, nobody comes to work in order to have a not very productive conversation with people. Okay, so because this is a coaching conversation, there's probably a clicker somewhere. Someone in the pocket, yeah. Can you just click me down one before we get started? So because this is a sort of a coaching orientated conference, I'm going to invite you to just talk for a sec rather than just listening to us. It's a bit much. And the microphone's gone off too. Okay, so we're going to invite you to just have a chat together. Could you just talk to the person next to you in conversations with clinicians, so in your conversations about your health and well-being with a social care or a healthcare practitioner, what's important to you? Can you just have a chat to the person next to you for a sec? Okay. So if I could just invite you to bring those conversations to a close. Thank you. While I'd love to hear some feedback about what you're saying, and I imagine it's all pretty different and personal, I'm imagining some of you said, well, I really want someone to be able to listen to me. Or I imagine others said, I really want someone who knows exactly what's going on. I've got confidence in their ability to help me understand what the issue is. Some of you might have said, I want, someone who is an expert or someone who will tell me what to do. Yeah? The reasons, the things that we want from our health and care providers is various, and it's different for everybody. But I'm just wondering for a second, did any of you say an opportunity to discuss my behaviour change options? No, probably not. But we need to be finding a way to introduce that into the way we have conversations with people. Yeah? And we need to do it in a much more clever way than saying this is an opportunity to discuss your behaviour change options. Okay? We know that 60% of premature deaths are caused by detrimental health behaviours. You probably saw the BBC thing this morning. 11 billion costs the NHS every year because of various physical inactivities, smoking, alcohol, obesity. 70% of the spend on long-term conditions, as Penny mentioned, and the waste in medicines. I mean, it's enormous, and we all know about it, and you all know about it, otherwise you wouldn't be here. So, the premise of health coaching is we need to find ways to actually work with people in a different way, to have different kinds of conversations. And the problem is that isn't easy to do. It's quite countercultural. It's hard because there are all sorts of barriers and interferences that are there. Like for patients, I hear consistently from people that there's sort of internal interferences. They're anxious about what's going on. There's fear, there's beliefs and expectations about what should or shouldn't happen. There are external interferences like the family or even car parking, what's going on, what they're thinking about. And then, there's this role identification. Many people believe and see themselves as needing to be told what to do. Or they go into interactions with our systems expecting to be treated in that way. And it's also difficult for clinicians. So having worked with people for a long time now and having trained clinicians for many years, probably in the wrong way to do it, there are all sorts of internal interferences for us as well. So the internal judgments that we have, the kind of, how I'm feeling on the day affects my presence and my ability to adopt different behaviours. Sort of time pressures, all sorts of other things, but especially, and we've seen this consistently now, our identification with the role of helping, of giving care, of providing help, really is very difficult to overcome. And of course, we don't want people to not help and not care, obviously. But I think this role identification is very, very important. And I think about my own experiences as a clinician, particularly as a young clinician when I didn't really know what I was doing. And it was really important for me to be the expert. I remember working in a pain clinic for a number of years, and there was a young man, David his name was, who used to come and see me. He would travel about 4 hours in one direction and 4 hours back, because I worked in Australia, as you can tell from my dodgy accent. And he had a leg amputated, so he'd lost his lower leg in a farming accident. And after 18 months of seeing him, I used to see him every 6 or 8 weeks. He'd come down to work with the pain management around the leg. I said to him, David, look, is this really working for you? Because nothing seemed to change. And he said, well, no, not really. I said, why do you keep coming back? And he said, well, because you keep asking me. And then I said, well, does any of it important to you, what we've been talking about? And he actually said to me, well, not really, but I know it's important to you. And for me, that was probably one of the most humbling experiences of my life as a clinician, to think, actually, the way I'm doing this isn't quite right. There's something going on here about my assumptions and the way I see my role, which needs an adjustment. So, I don't know if any of you can relate to that, but for most clinicians, we know that actually what we bring into the conversation affects the conversation. So we've kind of ended up with this traditional approach of telling people what to do, and it's inherent in the way things are structured, and it works very well in acute medicine. Okay, but for lifestyle change and for actually working with people in a different way, it's not so effective. So, in a kind of generalist way, we have a culture of telling people what to do, where the clinician is seen as the expert. Decisions are often made by the clinician or influenced by the clinician. Patients believe it's the other person's role to fix them, and there's a lot of pull to do that. Even when I are in that role, in the patient role, I expect someone to help me. So it's normal. The goals are often suggested by the clinician, and there's really a focus on what we call in psychology extrinsic motivation. So the thing outside of us, avoidance of pain, or getting some reward. And what happens is the psychological factors inherent in change don't really get considered in that sort of setup. So we have the clinician basically offering everything to the other person, and there's really good reason for it. We want to help. I got into healthcare because I wanted to help. I wanted to be of service and to help people be better, okay? But I'm not sure that some of our assumptions about how to do that are always quite effective. We hear people like Angela Coulter, who is an expert in the relationship and shared decision-making, saying we need a different kind of conversation with people. And that's been around as an idea for quite a long time now. But we have to stop treating people, in my opinion, as passive recipients of care. We have to work with them in a way where they're involved and more activated. So Penny mentioned Ruth Wallever, who's always been one of my heroes in this field, and she's sort of saying that she did a review of something like 250 studies to come up with a consensus definition of health coaching, and we desperately need some commonalities in how we approach health coaching, because everyone's doing something slightly differently. Ruth says that we need to think differently about the role of the clinician and the role of a patient. So effectively, we need to think about a patient, is at least partially determining their own goals and using self-discovery and an active learning process together with content education where it's needed, to actually work towards those goals using self-monitoring and a way of engaging with the provider in more of a coaching-orientated style. Okay? And we need clinicians, therefore, to change what they're doing. We need to adopt a different way of working so that clinicians are actually trained in some behaviour change theory. They actually learn to use motivational strategies and communication techniques that develop intrinsic motivation, so things that the person really wants for themselves, so it's coming from the individual, not from an external source, so that would lead towards more improved health and well-being. So it's a much more holistic approach, and I know that most of you probably already see it that way, but it's interesting to find this as a way of actually working. The result is where we have a culture of actually encouraging people to be resourceful. People already are resourceful. And health coaching sort of proposes a different mindsets needed by the people offering care. So in a health coaching approach, the patient is viewed as the expert in their own life and they contribute to generating their own solutions, like Sue mentioned. The decisions are made in partnership, like the massive work in shared decision-making shows us, and that people actually believe they have an active role to play in their own health. People are involved in actually measuring their own goals, and the focus on both intrinsic and extrinsic motivators are really important. So, in that sense, it's a much more of a psychologically minded approach among clinicians. Now, as a psychologist, I probably hold that opinion. But most clinicians that I know who are really, really effective are thinking a little bit deeper than just the numbers or just the symptoms and signs. Okay? People ask me to say a little bit about what a coaching approach is in general. So if you think about like a common coaching approach, was not necessarily a health coaching approach, but we use this in developmental coaching. Effectively, the idea is to gain clarity around what the important topics are for the conversation and establish a specific goal for the conversation. The reason we're offering you this is to get a sense of what coaching is if you don't already know. I imagine most of you do. Thirdly, the idea is to help someone expand their awareness about what's going on, to actually really develop their understanding of their experience so that it's broader, help them make more connections. Is then to support the person to take new ideas, new perspectives to what's going on, so that they can generate new ideas of what they could do to address whatever is the topic for their conversation. And then the idea in a general coaching model or approach is to support someone to actually plan actions that they would take to make a difference and make a change. Okay? So we're not suggesting for a moment that health coaching should replace all clinical conversations. Please understand that. Okay? But when a behaviour change is what's part of what needs to happen, then this kind of approach can be extremely effective. Okay? Effectively, what you're trying to do is help the person think more and differently, help them raise their awareness about what's going on, help them really understand their own experience, rather than just tell them, get their history and tell them what to do. Does that make sense? So when I was trained, the idea was find out why the person's there, or actually I usually knew why they were there. I'd sort of tell them their goal. I'd take a history so I could work out what's going on, and then I'd generate my brilliant solution and remind them of what that is on their way out. Strangely, I wasn't that effective. Okay? But I did it from the right place. I really wanted to help. Okay? What health coaching is suggesting is really help someone raise their awareness about what's going on so they can actually start taking responsibility for themselves. Because people are resourceful. People can resolve their own difficulties, and they actually know how to do it better than we do. Okay? There is some specific knowledge and expertise we need to offer in our role as health and care professionals. But what we want to do is help the person generate their own insight, because once they've had an insight, they can't argue with it when it comes to taking action. It would be nice if it was just an easy coaching conversation, but it's not. So in health coaching, it means actually taking all the great things we know from from clinical and health and behavioural medicine and behaviour change science to actually combine those techniques, knowledge, evidence-based techniques that we know work with what we know works from performance and development coaching, and include the skills, experience, expertise, knowledge of clinicians or care professionals. Okay, so it's not as simple as just having a straight coaching conversation. It also involves bringing in the knowledge and expertise of the clinician so they can use it appropriately in conjunction with those skills. I hope that sort of makes sense. And what we're aiming for particularly is a shift in the way people do what they do. So in the training that I've been involved in, what I've found is that it's really useful to help people develop use some health coaching techniques. And the techniques are really useful in most behaviour change conversations. So they're really good for that. And you wouldn't use them in every conversation, but when you need a behaviour change conversation, some of the health coaching techniques are really helpful. Then there's health coaching based knowledge and skills that actually people can use in just about every conversation, because we all know that better listening is going to be helpful, or better questioning skills are going to be helpful for people. Using challenge and support more effectively is going to be helpful in lots of conversations. And what we're trying to get to is the coaching mindset integrated into the way we do our work, which is going to be helpful in most things. So what I found after training a lot of leaders in the health system to use coaching, some of who were clinicians, very few of them actually started using it clinically. But it's really interesting, when you work with people who have a clinical or care background and train them in coaching or health coaching, nearly all of them start using it to change the way they interact at work, with their families, and in their management and leadership roles, because it's not seen as just a management technique, it's seen as a way of being. So this mindset piece, I think, is the key. If we can get to a mindset shift, then we're all happy, and it actually creates a change, because it becomes just a part of the way we do things, and then when we need to actually have a very specific behaviour change conversation, we can adopt a technique. I don't know how to tell you what the mindset is. The only way I know how to do it is to give you the experience of it. Okay? So can I invite you to stand up? This is actually a bit of participation. And find someone who you didn't come with to have a conversation with. Actually, you're not even going to talk. This is deliberately uncomfortable making experience. So can you please stand up and find a partner? Everyone got a partner? This only works in pairs, so if you're a three, it's not going to work. If you don't have a partner, just stick up your hand and we'll find someone. Yeah? Oh, well, you can do it together, that's fine. Okay, so as I said before, this is a deliberately uncomfortable making experience. The reason it's uncomfortable making is that it's a silent interaction, okay? That's going to be tough for some of you, I know. That's why I'm trying to get you to do it with someone you didn't come with. It might be a little bit easier, okay? So all I'm going to do is, have any of you heard of the idea of rose-coloured glasses? Yeah, so you look through those glasses and everything looks amazing, you're in love, it's beautiful. We're not going to be doing that, you'll be pleased to know. But I am going to be asking you to adopt different ways of looking at the person in front of you. Like as if you were putting on different pairs of glasses, different lenses, seeing that person in different ways. Okay? Does that sound all right? So please have a look at, it's only going to take about a minute, a little bit longer than a minute, so don't worry too much about it. Okay? And it's silent, so please see if you can keep your process to yourself rather than upset the other persons. Just have a look at the person in front of you. And what I'm going to ask you, don't look at me, look at them. Yeah. What I'm going to ask you to do is, just for a moment, put on a pair of glasses or see the person in front of you as a patient or a service user who is a problem for you. It's a silent exercise. Just see if you can see the person in front of you as someone who is a problem for you. And just notice Any thoughts or feelings you have when you see that person as someone who is a problem? Any sensations, how you experience it? And in the same moment, I'm going to invite you to just recognise that that person's seeing you in that way as well. How does it feel to be seen as a problem? Okay, so look away for a sec. Okay. Number 2, I'm going to ask you to look again. Just look at the person you're with. Don't look at me. This time, I'm going to invite you to see the person in front of you as a patient or a service user who has a problem, who needs your help. This is someone in front of you who has a problem, who needs your help. And just notice any thoughts or sensations you have when you see the person in front of you as someone who has a problem, who needs your help. And in the same moment, just recognise again, how does it feel to be seen as someone who has a problem and needs help? How does that feel for you? Okay, look away again. And third and final time now, all right? Now, you might be thinking, where is he going with this? Okay. But I'm going to invite you to make eye contact once more. Don't look at me, look at the person you're with. And this time I'm going to say, could you please put on a pair of glasses or look through the lens of seeing the person in front of you as someone who has a purpose in life and challenges to meet in the pursuit of that purpose. Here's someone in front of you who has a purpose in life and challenges to meet in the pursuit of that purpose. And how does it feel to see the person in that way? What's your experience? Thoughts or feelings you have? And in the same moment, how does it feel to be seen in this way? Someone who has a purpose with challenges to meet. Okay, thank you. Now, no one said anything about sitting down. No one said anything about sitting down. People think better when they're standing up. Can you just have a chat about your experience of looking in those 3 different ways? Okay, so I am sorry to interrupt your conversations, because I'm sure you get... Huh? Yeah, I can't do that. It's my nature to do that. But just, I know that some of you could probably keep talking, yeah? Especially after all that quietness. So we don't have a time. I'd love to hear back again from you about your experience of looking at people differently. And I know it feels a bit weird, and potentially, you didn't expect to come here and get that intimate. But there's a purpose underlying it. I know how uncomfortable it is to see someone as a problem, and I know we wouldn't choose to do that. We wouldn't aim to do that. No one sets out in the morning to see a patient or a service user as someone who is a problem. However, do any of you have heart sync patients on your lists? Yeah. When you look down the list and you think, ooh, that one's going to be tough. And you know what? Patients have heart sync clinicians on their list. And they think, oh, I don't want to see that one today. Okay? The issue is that none of us do it on purpose, but it's still there, and we think we're very good at hiding it, but the research shows us we're not. Okay? People know it has an impact. Second one, seeing the person who has a problem but needs your help. Now, it was kind of nice because about a third of you went, "Oh," at that point. Oh, they need my help. And, you know, that's what often happens with people in this experience, you know. And for me, there are kind of two responses we get when people need help. Either they recognise that help's needed. Either they feel really good about it and grateful because they want the help, and it's good. Some want it a little bit too much, okay? Or they kind of feel a bit resentful. You know, you don't really see me, you just see me as someone to help, okay? Finally, this idea of seeing someone who has a purpose in life. Now, I know that's a little bit at some level for some people, but actually, I saw people standing up a bit straighter and nodding, sort of this unconscious affirmation of the other person and who they are. And that's the kind of mindset that health coaching is aiming at. Can I really see the person in front of me as resourceful, as someone who has the potential to self-manage? It's in the business, we call this sort of moving from the idea of seeing someone as a problem that needs fixing, which is a very mechanistic, very biomedical. There is 200 or 300 years of biomedical model of weight pulling us in that direction. Can we shift our gaze at the same time to see the problem as see the person as resourceful and able to address and hold the solutions to their problems? Does that make sense? That's what health coaching is inviting us to do. And there are all sorts of things we can do to work with it. So in the sort of clinical conversations we need them to be goal-orientated. We need to introduce more... You can sit down, sorry. Then you can... Because it's looking a bit funny now, there's only about 5 of you left, stand up. You know, we need them to be goal-orientated. We do need them to introduce more trust and rapport, more deep listening, more empathy in our conversations. You know, so we get more disclosure from people. We get to the real heart of things. We know what's really going on. And we develop some cognitive dissonance between what someone wants and where they want to be, okay? And from that, generate challenge, believing in the person to generate new thinking and taking action which is meaningful to the individual. We're trying to support someone to change the way they're seeing the problem. And the reason why I came up with that definition for coaching is that, you know, with long-term conditions particularly, they're not going away. We need to encourage people to change the way they're seeing it so they can reorientate their life and their work with it. I was also asked just to really quickly offer you some ways of thinking about the conversations that you have today, because, you know, this is not just a talk from the front kind of day. There's a lot of conversations. You know, in having a better conversation, there needs to be some preparation. Well, good luck today because you won't have much time to do it. But, you know, looking at what the goals that people have is important. Actively listening, which we all know how to do as clinicians. It's just about having the time and space to do it. Encouraging reflection in the other person that you're talking with. Inviting the person to generate their own ideas and creating ownership. And then encouraging the person to take action. So in particular, there's going to be some table conversations quite soon. And in that time, really engage together to actually utilise some of these approaches. Finally, now, I never really thought at a health coaching conversation I'd quote Charles Darwin, okay? But I was sitting on a plane the other day and I read this quote and it really, really struck me. It's not the strongest of the species that survive, nor the most intelligent, but the ones most receptive to change. I think we need to change. I think we need to change the way we're doing things. I think we need to change that for patients because they deserve it. And everyone in the NHS is talking about patient activation. Really, to get patient activation, in my strong opinion, we need clinician activation. We need people to be different in the way they're having conversations. And we need a system that's activated and prepared to allow that to happen. The people that we serve really deserve it. And it will make a more positive difference in the future of this great system that we've got. Thank you.